With so many different ways to support one's healing journey, sometimes it's challenging to know when to engage a licensed therapist versus, for example, a life coach. So that is a topic that we'll be digging into today in this video. But first, welcome. Hi, I'm Stacyann Forrester, astrologer for women who are releasing old ways of being while embracing their unique path forward. And I'm here today with founder of the Black Girl Doctor and licensed psychologist, Dr. Taisha Caldwell-Harvey. Welcome, Taisha.
Thank you. Thanks for having me. Excited to connect and have this conversation. I think it's super important that we parse out the differences. I think a lot of people get confused, and I'm excited to dig into this with you.
Absolutely. And just so some extra background for the audience, as someone who works with clients as an astrologer, not as a therapist. Usually my clients, they are working with me and other supporting healing professionals. So this is a great conversation to help guide people as when they're thinking about their whole healing journey, how and when these differences might lie. So with that, I want to jump in with our first question. And as a licensed psychologist, what do you see as the main differences between therapists and life coaches? And how does one start unraveling when to seek out one versus the other?
Yeah, I think this is such a large question, and I want to break it down a little bit and start with like, what is therapy? I feel like that is super important, and I think that it's this it feels like this intangible thing, and so I want to just give it some meat, maybe. But I'll start with just saying that therapy is the process of meeting with a licensed professional, and therapy is a healthcare service. It's something that happens in a confidential environment for the purpose of resolving, exploring, healing things that you might find distressing in yourself. So whether that's behaviors or beliefs or feelings, and sometimes even physical symptoms that are causing distress. And we're talking about like mental distress or even mental illness. And I want to just stress again, therapy is a healthcare treatment. And so things like, I feel depressed, I'm anxious all the time, I can't concentrate, I'm grieving and I've been grieving for a long time and I can't find peace, or I'm having this repetitive behaviors that I can't resolve, or I saw my doctor and they're saying there's no physical explanation for some of the symptoms that I'm having. Like, these are all kind of things that you might see a therapist for. And then I want to highlight just some things that happen in therapy that might not happen, or that likely don't happen in an environment with a coach, is that you're going to get a full psychological evaluation. So that first appointment with a therapist, we usually call it an intake or an initial evaluation. They're going to ask a ton of questions about your history, your background, your medical history, and it's going to be a thorough health evaluation. Sometimes you're going to get a diagnosis, and there'll be a treatment plan in terms of like, what is the plan in terms of how we move forward and help provide some relief to the symptoms that you're feeling. And then something that's unique, I think that why it gets a little blurry with therapy versus seeing a physician, is that in therapy, it relies on this special relationship between you and your therapist to facilitate healing. So as a therapist, we use ourselves as tools to help you heal. Which is one of the reasons why it's super important that your therapist isn't your friend or a family member, because one of the things that we have to do is remove as much bias from the room as possible so that we're a tool. And you can't ever remove all bias, but you definitely can't, have no chance when it's family and friends and people that you know personally, right? And so us as ourselves are a tool in that process. So I really think of therapy as this dance that you do, but that happens between the therapist and the person seeking therapy. And one theory, how I practice, really is, moving from this place where distress comes from this misalignment between who you are truly, and how you are functioning in the world in terms of how you think about yourself, how you're behaving in the world. And there's a lot of factors that can contribute to being misaligned, right?
Right.
But as a therapist, I am there to learn about you, who you are from a factual place, like your history, your culture, what you've been through, and then who you say you are, what you do every
Mm,
day, what your patterns are, how you do what you do, why you do what you do, what you believe and what you want. And then together we start making sense of the things that are misaligned. And
mhm.
that can alleviate a lot of symptoms.
Right.
Um, and then I'll just add one more thing is that therapists are also trained to recognize when talk therapy isn't going to be effective or as effective as it can be, and when medication might be helpful. And so we then provide referrals to a
Mhm,
physician, a psychiatrist, so that we can talk through medication and how we can all work together to kind of get you to the place where you want to be.
mhm. Great. And, someone sitting at home listening to this conversation, who might be in that place where they've recognized an issue that they want to work on.
Mhm.
When do they know this is definitely something to engage a licensed therapist versus
Mhm.
another type of healing professional? Are there some guidances from your perspective that you can provide there?
Yeah. Well, I'll say when I think about coaching, it
Mhm,
is, and it's another tool that you can use to help yourself, right? But it's very different than
mhm,
seeking out healthcare treatment. So when I think about coaching, coaching is the process of meeting with a guide who has expert knowledge in a very identifiable area, right?
mhm,
And you can use that as, you can use those tools that they can teach you to help improve your life. And so
mhm.
I like to think about coaching like you're taking a course on a topic, but you get this added bonus of having an expert guide, like to be there with you, guide you through it, hold you accountable, course correct when you're like thinking about things not in the right way, not implementing all of that. But a difference there is that you're not going to get a psychological evaluation, you're not going to get a medical diagnosis.
Mhm.
Um, and um, and I think that there is, when you think about kind of the differences, I always think, are you in pain, right?
That's a great question.
It's a big one, right? I think a
Yeah.
lot of times people sit in this balance between like uh poor mental health and mental illness. Like there's this kind of like I'm declining, and then when we decline so far for so long, we actually develop a mental illness, right? Which is, some people think I think it's a scary word, but it's really not. I think mental illness means that there is a diagnosis, a label that can be applied to the symptoms that you're having. And why that's really helpful is because when we can label something,
Yeah.
then we can look at the research and say, what are the best ways to heal from this, right? So
Mhm,
I like to think of like, I don't want people to think of diagnosing as being a scary thing or a bad thing. It's actually
mhm.
really great because it provides a lot of clarity and there's a pathway. Like these are the things that work for this, right?
Mhm, mhm.
But there is a space where it's kind of like things are not going well. I'm struggling with something. I'm struggling, and there's this kind of point where it turns into like suffering and prolonged suffering. And I think
Mm,
that it's really important that, um, I really want to encourage everyone to take a stance that like we are not meant to suffer, right? So suffering is not a thing. And so are you struggling with something or are you suffering, right? And struggling means you are actively doing things to move yourself out of something, right? It is
mhm.
an active behavior. If you are just experiencing pain and distress every day, that's suffering,
That's
right?
mhm,
And so I think, again, to just take that mindset, like I am not meant to suffer, I am not meant to suffer. And so what are the things that I need to heal myself?
mhm.
I think that therapy is never a bad place to go if you don't know what you need, right? I think,
Mm,
to like, I don't know, I just feel bad, I need help, right?
it's
Going
a
to
great starting point.
Exactly. A lot of times you see people transition from therapy into coaching, right? And so it's
Mhm,
like I've been in therapy for, a couple months and I've learned some things, but I want to like practice those things and do those things and like live my
mhm,
life according to the way that I have some clarity. And I might start working with a coach at that point, right?
mhm. Great.
There's also some places where you're like, I don't know that I need a healthcare provider, but I actually have something very specific I want to work on, right? So,
Mhm.
and there's this coach that has this specific set of skills and knowledge, and I think that's a good place.
Mhm.
There are coaches that are able to refer into therapy. Coaches do refer to therapy, but one of the things, well, I think, well, I really, one of the things that I feel like is makes it challenging is that the coaching field isn't regulated, right? And so there's
Mhm.
not a license, so you can't assure that every coach knows how to get you to the right
Mhm.
place,
Right.
right? And I think, which is why I say it's never a bad thing to start at the therapy if you don't know what you need.
Mhm.
And then, be able to be referred into a different kind of care. Um,
Mhm.
but I also
And
think that some people like aren't ready for therapy
yeah.
and or it feels really scary. And so
Mhm.
sometimes getting support from someone else will be the thing that lets you realize like, oh, like I'm hurting at a deeper level. Like this is not just, I need to work on this one thing. There's some other stuff deeper I want to like really unpack.
Mhm.
And then it could be the thing that helps you realize like I need to go into therapy.
Yeah, yeah, that definitely happens in my experience working with people where, astrology, we use it as a tool and it
Mhm.
could show where the issues are. But if they need deeper level of support, that's when they know to go to a therapist. Uh,
Mhm.
so you, through the Black Girl Doctor, you do provide also, correct me if I'm wrong, coaching as well.
Mhm. We
Both.
do. Yeah, we do both.
And in the past, I've worked with someone who was a therapist and a coach, and having those
Mhm.
dual skill sets, super helpful, super helpful. So you want to
Yeah.
say a little bit about that?
Yeah, so it's so interesting. Like the need for therapy is so great right now. There are not enough therapists to meet the demand of folks that are coming in, and there's a lot of work that coaching can do for to work on some things that don't necessarily need therapy, right? And
Mhm.
so it's a great space to be able to offer both. And the way that we think about coaching at the Black Girl Doctor really is, again, like if you want like you kind of know what you should be doing, but you're not doing it, right?
Mhm.
If and so we our coaching is focused on wellness coaching. We focus primarily on professional women in the workspace. Like I'm trying to live my best life. I'm trying to achieve my goals, but I want to live a balanced whole life. That's our area of focus in coaching. And we
Mhm.
can help you do that, right? But this is your coach is going to be very different than your therapist in this space, and so
Mhm.
your coach is going to work with you on setting some concrete goals, like okay, how do you want to be living? What are things you're trying to work through? Maybe you're struggling with relationships at work or relationships at home or something like that. We're going to
Mhm.
make a plan. We do what we do. We use a single session coaching model, which basically, in the way that we set up our sessions, is that we're working on something very specific in this one 90-minute session. And then the expectation is that you are taking those skills and you are implementing them, and you're not
Mhm.
scheduling another session until you have done the things that we've talked about and you're ready to come back to follow up and kind of process, talk it through, and move on to the next phase. Every coaching, every coach works differently. That's our model. And so when you're kind of like, I would like to be gathered, right? Like I need someone to hold me accountable. I want to do these things. I want to be on the right path. That is how we use coaching in our practice.
Mhm.
It's a great transition out of therapy. And so
Mhm.
you've been talking about things with your therapist. You have a new plan of like how you're going to think differently, move differently in your life. You're feeling better, and we're like, okay, like you can like let's move into coaching where they're just going to hold you accountable for those things, right?
Mhm.
Um, what was I going to say? Yeah, and so I think. Oh, go ahead.
So I wanted to bring us back to the topic of therapy and working with a licensed therapist. And if someone has some resistance about therapy because of the stigma around it,
Yeah.
um, what would you say to that? Like, how would you help someone, become a bit more open um, to therapy itself because of, maybe the stigma associated with seeking professional medical help in this way?
Mm-hmm. Yeah, I think, well, first doing things like listening to your show and having like these kinds of conversations are really helpful because you put a face to like the provider, right? And
Mhm.
a lot of times we see people when we do live events, like if you go to, a talk and there are therapists there, you kind of like, oh, like that's what a therapist is. Like this is what talking to this person, might feel like, and then it feels more comfortable. But I would also, I also want to encourage people. To not to not deny yourself one of the possible ways to heal, right? Again, like
Mhm.
therapy isn't necessarily the right choice for everybody, but it is an option that's on the table. And I think that when there's stigma, what it does is it takes one of the options off the table for you. And now you're not getting all of the data. You're not able to have access to all of the things that could help you, right? And
Mhm.
so I think to really think about like what is this that makes me afraid of this, right? Because
Mhm.
I might think like, oh, maybe acupuncture is right for me, and am I willing to go try, right? Like am I willing
Mhm.
to go to an introductory session? Am I willing to talk to a provider about it? Am I willing to make that one initial consult appointment to see what they can offer me? And there's not much harm that can come from exploring all of your options. And I think that when we don't do that, it is such a disservice to us. And when I think about
Absolutely.
the different communities and how it is targeted, usually at certain groups that are less likely to engage in certain forms of healing, I think about where does that come from? And then it kind of motivates me. And I'm like, who doesn't want me to have
Mhm.
access to this, right?
Yeah.
Like my oppressor? And
Yes.
where did this come from? Because it usually doesn't come from a place of love,
Mhm.
to yourself. And so I would say to keep yourself open and not try something because somewhere you've heard that it's not good, but don't do something because you've explored it and you decided it's not for you because you have the information. Um,
Mhm.
I want to encourage people to get the information.
Absolutely. And I would just add that it's important to try different types of therapy too, a different
Mhm.
therapists. So if you
Yeah.
go to a therapist and it's not vibing for you, don't
Yes.
think that's all. That's all
Exactly.
therapists.
Yes. Therapists are
Keep
different.
trying. Very
Mhm.
different
Mhm.
personalities, different modalities that they use. And so, part of this series that I've been putting together is introducing other licensed therapists who work in maybe sound healing, EMDR, all these other types
Mhm.
that are just as helpful that people may not know of because talk therapy is I think still the gold standard and still what we typically
Mhm.
associate with seeing a therapist. So yeah, just don't give up. Keep trying, and the right
Yeah.
therapist, you will find the right therapist. And on
Mhm.
that note, I want to finish up here with that question
Mhm.
about how do we how do we talk to a therapist to make sure
Mhm.
that it's the right one for us? Is there an interview process that
Mhm.
you recommend people do to kind of gauge if someone's going to be a good fit? And of course, you never know until you're actually working with them, but there might be a
Mhm.
few things that we can do to kind of vet who is right for us.
Yeah, definitely. So one, I definitely, so most therapists offer a free or very low cost initial appointment where it's just like a brief 15 to 20 minutes where you can meet them. And that I would say definitely take advantage of that and do that. And it's your opportunity to see if you're vibing with that person, right? And so
Mhm.
in that space, the therapist is interviewing you, but it's more about understanding what it is that it's going on for you so that they know if they can help you, right? So
Mhm.
therapists have different specialties, different areas of expertise, and we're also humans. And so there could be things going on in our own lives and reasons why certain things that you might present with might not be a good fit for us either. And
Mhm.
so that's a lot of the times like we offer it free. Most therapists offer it free just because, you don't need to necessarily pay for something until I know I can help you, right? And so but that is also your chance to decide like, does this feel like a good fit for me, right? And I think some of the things that I would encourage people to look for is this person listening to me? So did you feel like you were able to share what was going on? They were in tune, they heard you, like they were able to kind of repeat back, like, what did you say? And yes, that's what I'm saying to you. You should have this, oh, this person understood, right? They got it.
They got it.
They got it. I would also, really listen to your gut and trust that. A lot of times you're just like, oh, this feels good. And then I think there's this narrative that has been going around, like you need to interview a lot of therapists and then decide on who's the right one. I really don't think you need to interview a ton of people. I think you need to meet the person. If it feels good, move forward. And then if it doesn't feel good, though, interview somebody else, right? And you want to ask about their experience in working with people that are struggling with the same things that you're struggling with or something similar. So like, have you ever worked with somebody, that is dealing with depression, or, what's your specialty? The therapist should tell you their modality and how they work and kind of how, like what they're thinking of, like what you're saying. So if you're sharing your symptoms, the therapist should be able to give you an overview of like, oh, okay, like they're not going to give you a diagnosis in the session at all, but they should tell you how they work and what they would do with you, what treatment would look like with them. And if that resonates with you, that's a really good sign. If you're like, that sounds nice, that sounds like something I need, right? And then another thing I would say is, do you feel a little scared and a little uncomfortable? And those are good signs. And so I think that it is sometimes scary to be vulnerable. And when you do something different, when you are opening up something new, there should be some kind of reaction, right? And if you're completely comfortable, usually you're kind of at status quo and nothing is changing for you. But if you meet with somebody where you're almost like, oh, this is a little scary, that I might like open up and I don't know what's going to come out, right? Like that's a very good sign, because it also means that you might be comfortable in that relationship. And I think
that.
Fear is a good sign, right? And then the last thing I'll add is, do you feel like you can be yourself? That's what I want to say. And so if you are, code switching, if you are like you can't fully talk how you would normally talk because you think this person isn't going to get it, you have to act different, that's probably not a good fit for you. So one of the things I love about being a therapist is working with clients that, particularly when I'm working with clients that are from the same cultural background, so working with other Black clients, and the way that they speak to me so freely and openly, and I'm just like, I know this person would not talk to a therapist of a different background like this, right? And it's like you can provide that free space, and it doesn't always have to be a cultural match, but you need to be able to feel comfortable, like you can be yourself. Yeah, otherwise, what are we doing? If you have to, put on a face like you do in other spaces in your life,
what's the point?
What's the point?
Yeah, that, like, all of that was amazing. So thank you for sharing that with us. Thank you for being here. If people want to reach out to you, learn more about the Black Girl Doctor, how can they do that?
Yeah, so we're really easy to find. We're at The Black Girl Doctor on all social media. So we're on Instagram, Facebook, LinkedIn. Not very active on TikTok.
Not yet.
We'll see. We'll see the future, right? So we'll see. Or, our website is www.theblackgirldoctor.com. We have a phone number online. We answer the phone. We'll get you connected and to the right place you need to be.
And I will leave all of that information below in the description box. Again, thank you so much for being here, and we'll be in touch. So thank you, everybody. Bye.